In our podcast today, we present to our viewers an interview with Dr. Laverne Jackson, a highly respected consultant in the medical field. Dr. Jackson has her doctoral degree in human services with a specialty in management of nonprofit agencies. She holds a master's degree in public administration related to her specialty in human resource management. She currently resides in Las Vegas, Nevada, and has her own blog site. Dr. Jackson, as a blogger for many years, will be sharing her skills as a valuable member of the Money Connection blog authors. Ladies and gentlemen, we proudly present to you our Money Connection interview team, Mr. Harvey and Mr. Bishop, with a special guest, Dr. Laverne Jackson.
We appreciate our guests coming in today. And on our podcast today, we have one of our bloggers, Dr. Laverne Jackson. We appreciate you joining us, Dr. Jackson, and just wanted to ask you a few questions today and sort of introduce our audience to you. And we want to just ask you, tell us a little bit about yourself.
Well, I'm currently a consultant based in Las Vegas, Nevada, and I'm loving Las Vegas. I specialize in primary health care, grants administration and grant writing, and nonprofit organization management. I have a PhD in human services. I have a master's of public administration specializing in human resource management, and I have a Bachelor of Science degree in nursing. I served in the Army Nurse Corps for 4 years. I am passionate about God, equality, writing, and educating. And my hobbies are gardening and fishing.
Okay. Well, um, now you have a lot of education. And one of the things that, why we wanted to try to really recruit you regarding our blog is that you have a passion for certain things and a theme in your blog. Tell us a little certain things in your blog that you're really trying to connect with the people.
Well, my blog primarily focuses on issues that most people are find difficult to discuss, but that are there and sometimes generate a lot of internal conflict because they kind of hibernate, and that results in unresolved issues. Uh, and I think that the longer that you live in life, the more important it is to have some closure on particular issues. And then I also focus on issues that are affecting society and primarily African American society. And I believe one of the best vehicles that we have is information. And so a blog is just another mechanism or instrument or avenue to be able to get that information out there to people who might not otherwise have it. So it depends on what's going on as far as current events. It's based upon experiences that I have. It's based upon, my blog is based upon observations that I make from day to day, maybe in a store or in a meeting. Watching and participating in meetings can be very interesting because there's a lot of group dynamics that are going on in the meetings. And one of the things that I like to do is to identify the hidden agendas, because the hidden agendas are often those things that will prohibit progress as far as being able to reach consensus on an issue. And so those are some of the things that I write about. I pay attention to Facebook posts from my friends, and Facebook posts just from the general public, what they're saying and what they're not saying. And those are the things um, that I put in my blog, because you have to be able to not have a fear of retaliation in order to be able to write about some of the things that I write about.
Okay. Now the one thing that I noticed in your blog, And the thing that is most important to me is that you are a very professional person, obviously, because you have a doctorate degree. Now, you mentioned consulting, and now because you are a consultant, what is your actual specialty as far as your profession?
I work primarily with community health and primary healthcare as far as the healthcare arena. I have a broad base of experience in healthcare, from psychiatric, nursing, to quality improvement. My last position, I was the director of what they call innovation and transformation, and my primary responsibility was to do research to keep the organization up to date on the changes that were occurring with healthcare transformation. So that meant a lot of identification of or projecting what was going to happen 90 days out or 6 months out or even a year out, and developing the programming not for what is happening right now, but for what is happening right now and what is going to happen in the future. So, I'm really pretty adept at that. And most researchers are, and that's taking information and painting a picture of what's happening now and what impacts are going to occur that's going to change things maybe in 3 months to 6 months to a year, maybe even 5 years. So those are the type of things that I do with healthcare, looking at operations, how refined those operations are. Some operations are still, especially in primary healthcare, when you look at federally qualified health centers operating as they were 20 years ago, 10 years ago, even 5 years ago. Healthcare is evolving so rapidly until it really takes a lot of scrutiny to be able to keep up. So that's what I do with healthcare. For grants administration, I kind of fell into writing grants and grants administration because I noticed the amount of money that the average person had to pay for a grant writer. And excuse me, the average amount is about anywhere from $8,000 to $20,000 per grant, which meant that an entire segment of people would be, or organization were being left out because they could not afford to write grants or to pay a grant writer that type of money. So I use a different approach in writing grants. My grants really are, I determine the cost based upon the amount of time I actually have to spend in writing the grant. And I do a lot of research too. I look at the organization's annual reports, those type of things, to determine whether or not what can they really actually afford to pay. And then not going to get wealthy doing that, but it does open up access to people who do a lot of hard work at the grassroots level and never get a chance to expand or grow because they can't afford access to things like grant writers. So that's how I got into grants administration and have been successful in being able to write grants. And my master's of public administration, simply wanted to know more about the government and how it operated and how policy was formulated. And so that gave me that foundation to be able to, when someone says something, or I hear something on TV, or I hear the president of the United States or this senator or that senator speaking, I'm able to understand exactly what they mean, what they don't mean, and what they left out. So that's very, and I use vehicles like my blog to pass that information along.
Uh,
Wow.
Dr. Jackson, I have a question for you. Uh, we've been in this new healthcare act that they started back in 2010,
Mhm.
well, they call it the Obamacare, but I call it the Affordable Care Act because that's actually what it is. What do you think about the Affordable Care Act?
I think the Affordable Care Act is like any other huge piece of legislation, and that is that it has good aspects and it has some that are not so good. And my experience with in Hawaii, in a very low income area, is that, so yes, a lot of the residents there have access to insurance that they didn't have before. However, they cannot afford to pay the premiums. So I think that when you go back for the second round of legislation, as far as the Affordable Care Act, that is an issue that needs to be addressed. On the other hand, if you look at this country, there are millions of people who had absolutely no health care. And I know some people personally who had no health care who now have access to health care. I know people who needed glasses and needed dental work and a lot of other care that they are now getting that they weren't getting before affordable health care. And so I think that it's still a baby. The Affordable Care Act is still in its infancy. It's still being rolled out. And I think that like any other thing that you're building, you have to go back and you have to find the things that are not working so well, and you have to fix them or strengthen them. And that's how I see the Affordable Care Act. I don't think it's something that should be eliminated because it's done far more positive than it has brought negative.
Oh, okay.
Well, the one thing that I found that affordable healthcare is that because of the cost of it, a lot of businesses are seem to be complaining that it's hurting business. Is that true? Would you?
That that's possibly true, but there's two prongs to that. Uh, what Affordable Care Act, and there was a lengthy period of time, between the passing of the legislation and actually uh, implementation. There was a lot of discussion. The act was out there before it actually passed through Congress, what it was going to be and how it was going to roll out. And I say that the businesses can look at it in two ways, as something that's really hurting their business, or they can see how they need to refine their business. How do they need to restructure their business model to comply with the requirements of the Affordable Care Act? I as a business owner, I would think that you would want to be fair with your employees, that you would want to invest in them to a certain extent, because you lose a lot of money and people don't realize that with turnover. And so to be able to retain those employees over a period of time, and that means that you can't look at what's happening now, but you also have to look at what's happening in the future, because over a period of time, you will recoup that money that you're spending on those poor employees for medical benefits,
Hmm.
in in the fact that you're not spending money training dollars on them because they've walked out the door and gone to employment where they can get those benefits. So I would think that employers, and I think that agencies like the Small Business Administration and other agencies should work with small businesses to help them to identify ways that they can expand their business model. They may need to do a little bit of diversification, those type of things, to accommodate the Affordable Care Act rather than to abolish it.
Well, Dr. Jackson, I hear a lot of from the politicians, especially Bernie Sanders and Elizabeth Warren, about the public option. What is the public option, and would that improve the health care or would it hurt it?
I don't think that it's going to hurt it. I don't know everything about what those public options are, first of all, uh, but I do believe that uh, Elizabeth Warren uh, is one of the people that listen to the voice of the people. She's listening to what they say, and that the recommendations that she's making is based upon that type of feedback. So what I see there as far as options are concerned uh, is that we don't go to the table with all the stakeholders at the table. I'll say that we depend upon the Elizabeth Warrens of the world, or of the U.S. to speak for us, and a lot of things get lost in the translation. And so I believe that those tables for conversation need to start at the very lowest level of the community and then move up. And I think that even at the highest level, that there should be some representation at that table from the lowest level. I just really don't feel that one voice or two voices is adequate enough when you look at the number of communities that we have in this country to represent the best interests of the welfare of those people. And I think when you look at options, I think that I believe that you sometimes have the wrong people at the table when those options are being developed, when they're being voted upon. And that's where I see the problem.
Well, one of the things that I've found out is that, now you can correct me if I'm wrong, I understand that something like 30, 35 states do not carry affordable health care
Right,
in their states on the basis on Medicaid or need. So
right.
therefore, that's keeping out anywhere between 3 to 5 million people out of the program. Is that
Yep,
true?
that's true. That's true. A lot of them refuse to expand their Medicaid coverage, and that's unfortunate. However, now we are back to one of my pet peeves. What I call
Uh-oh.
my what I call my
We need a
soapbox.
nerve.
Yeah, my soapbox is that we continue to send these people who misrepresent our interests to Washington, and we could continue to vote for them at the state legislature. So if you know that someone is going to go, some state representative or some state senator is going to go and vote not to for you not to have a better life, why do you continue to send these people to represent your interests? And if you look at some of these states, some of these people haven't been in office one or two terms, they've been in office many terms. And so I think that is that we're not galvanizing our strength as voters to to say we're really serious. If you do not go and protect my interests, you're not going.
Well,
Absolutely.
with Dr. Jackson, I think that a lot of people, especially here in the South where I'm at right now, don't understand about the Affordable Care Act, and they don't understand why they need the Affordable Care Act. And I think that a lot of politicians or people out there who are in the know don't want to explain to them exactly what they're missing. That this Medicare money, I'm sorry, is for people who are in nursing homes, for our children, and for other people who cannot afford health care. And that is not articulated and everything and stuff to them. So I don't believe that they really actually understand what they are losing and stuff when they are allowing their governors and their state legislators to say, okay, we don't want the Affordable Care Act money because they call it Obamacare. But it's actually, like I said, it's not Obamacare. It is the Affordable Care Act, which means that you have medical care. And these Medicaid payments and stuff that the federal government is wants to make to these states, it it's going to help instead of hinder the whole state as far as economically, as far as jobs, because when you start bringing in billions and billions of dollars into the medical field, then you're going to have more people out there who are going to have a job. You're going to have more nurses and stuff who are going to have a job. You're going to have more CMAs or whatever who are going to have jobs. So I think that we are probably doing a bad job of letting people know what this money means to the state. Other than being angry at our president, we need to be looking at our people who are sitting there and are suffering because they don't have this money.
Right. And we have to use audiences that are what I call captive audiences, and that is the mechanisms that we have within our culture to be able to disseminate information. And quite naturally, faith-based organizations is one of those mechanisms. Believe it or not, things like hair salons, barber shops, the places that restaurants, the places that we go are the places that we really be disseminating this information. And it's going to take time. It's going to take a collaborative effort. It's going to take volunteers. And when I say volunteers, some people have to realize that you're not going to get paid for everything that you do. And that, you should have some hopefully we'll have some internal gratification for doing something that needs to be done because you know that it is the right thing to do. And I know that that is not impossible because I grew up and was mentored in a community called Pembroke, Illinois, and it happens all the time. It happens.
Yeah.
That you know, and some of us are where we are today because of that type of mentoring and because that type of structure was provided. Somewhere along the line in generations behind us and even in our generation, we've kind of gotten tired, but we can't really afford to be that tired. And we've already also got to convince maybe some younger generations is an effective approach or effective strategy. Sometimes you do not want to throw out, you don't want to throw out everything that's tried and true because it was done 20 or 30 years ago. It may still work. It may need some refinement, but it may still work.
Mhm.
Well, I know that you have some place to go. You got things to do. You're a busy woman. I just want to ask you one more question. And in your own mind, what do you think is one of our, and when I say our, I mean African Americans, main problem in our community? And what would you do to solve it?
Well, I think there's a two-pronged answer to that. One, I would definitely say apathy. I have seen so much apathy, where people have really just uh, given up. And then the other prong of that is that I have seen people that have, I would say, have been blessed to be able to learn what they have learned and do the things that they have done. But they are also what I refer to as gatekeepers, meaning that you don't get through the gate unless you come past them.
Wow.
And and that is sad for many African American communities because there's a lot of innovative thinking and a lot of things that we can learn from other people. We need, in my opinion, we need to really learn how to reach out to help one another, to use whatever we've been given, intellectually, mainly the knowledge capital that is within African American society cannot even really be measured. And so, if we are able to bring that knowledge capital together and truly, really work together, and we're able to move past what is in our best interest, and sometimes have to sacrifice what may be in our best interest or what may be lucrative for us for the improvement or the progression of the African American culture, African American society, then I think that we would be able to do a lot more than we do. There's a lot of wealth in African, in our culture, in our communities. If
Well,
you
can I give you a word?
Amen, Dr. Jackson. Amen.
Collaboration.
right,
We
collaboration.
need to really collaborate with each other and reach out. And that's the one thing that this blog, what we're trying to do, and we're going to be reaching out to a number of different nonprofit organizations, different kinds of businesses, all kind of intellectual people like yourself, and just really reach out to people. Now, you're going to get a lot. We're going to get a lot of no's, but we're going to get a lot of yeses,
And that's
and
yes.
and that's how we're going to work it out. And if we can build this, and we like, of course, we appreciate you joining us, and we know that we're going to build a readership, and as we go on with our blog, we're going to have subject matter specifically on your subject matter and discuss in depth how we can do that health piece, because
Okay.
I think that's very important.
Okay. I'm looking
Yes,
forward to it.
yes, especially our men, our black men, our community who are dying because they don't have quality health care. And it's a very, very, very important issue and stuff for us. So we're going to be continuing to put a spotlight on this. And I want to personally thank you, Dr. Jackson, for joining our blog, and also for giving us access to your knowledge. And so we can put it out there on their social network, and everybody else will have access to your knowledge and your experience. And thank you so much.
You're very welcome.
Well,
I'm glad to do it.
yeah, thank you.
You're
We appreciate you, and we thank you for joining us. This is Ted and Ed's TV Money Connection. And our next one would be another fabulous guest. And we thank you again.
All
We
right.
appreciate you.
Okay, goodbye.
Thanks, Bye-bye.